Nurse-patient ratios. Why should you care? Can you describe exactly what a nurse does on a typical hospital ward? If your answer involved phrases like giving sponge baths, giving out pills, or emptying bedpans, you're right. These are some of the tasks an RN does in the run of her shift. However, describing a nurse's role like this is like describing a pilot's job by saying they turn on the airplane, make weather recommendations to the passengers, and put the plane's wheels up and down. The reason I choose to compare nursing to flying planes is simple. Kathleen McMillan, a nursing professor at Dalhousie, recently made a similar analogy in an article she wrote for the Chronicle Herald. She pointed out how frustrating it is when your flight is canceled due to the pilot's timing out and their allowed flight time. These safety regulations are put in place to ensure the safety of the lives that these pilots hold in their hands, but boy are they inconvenient. Establishing nurse-patient ratios is the nursing profession's attempt to put similar safeguards in place for the lives they hold in their hands. Over the years, the patient population that exists on a hospital ward have become more and more acute, or for lack of a better word, sicker. Advances in medicine and technology have allowed more and more people to survive chronic illnesses and/or devastating injuries, and thus have had more complex overall picture. The pilot's plane has changed its shape, size, and how it operates. Let's take a look at what a typical day in the life of an RN is like within Capitol Health. Susan's been an RN for 3 years and works on the neurosurgery floor. The patient population includes brain injuries, brain surgery, strokes, brain tumors, spinal cord injuries, spinal surgeries, and so on. Today, she's the second most senior nurse working. One of the nurses supposed to be working today has called in sick. Several of the nurses on the floor have had a stomach bug, and several of the patients have the same symptoms. The first sick call is never replaced as per management. This means extra patients for Sue. She sits down to get report on her 7 patients. She has about 30 minutes to read and remember the past medical history, allergies, current health status, diet, and so on for these 7 patients, 5 of which she's never met. She needs to jot down every need of every patient, every medication she has to give, the medications she might have to give, things to keep a special eye on, dressings to change, how each patient communicates, mobilizes, and how they use the bathroom. During report, she is interrupted several times. To take calls from families that are just wondering what kind of night their loved one had, or to help an elderly woman to the bathroom, tend to 2 beeping IV pumps, and prevent the upwardly mobile, brain-injured patient with violent tendencies from escaping the unit. This is an idea of the first 30 minutes of a 12-hour shift. Imagine the length of this if the other 11.5 hours were described. Throughout the course of the rest of her shift, Sue has to ensure the basic needs and special needs of each patient are met. Each patient is different. 2 are breathing through artificial plastic airways in their throat, needing help just to clear their own secretions. 4 have feeding tubes in their noses to deliver nutrition and medications to their stomachs. 3 have IV hydration and medications, and all 7 are at high risk of falls. In addition, 4 are confused and don't know where they are or what year it is. 3 need to be mobilized using a crane-like lift. 1 is violent and trying to escape. 2 have a fever. 1 patient had a seizure and needed airway protection and close monitoring. 2 have nausea and vomiting and diarrhea and require isolation. 1 needs discharge paperwork and teaching. 1 is fresh out of the operating room after having spinal surgery and is in excruciating pain, and the medications that are prescribed are not working. 2 families are irate that their loved one's diaper has been wet for too long. The doctors in the operating room cannot be reached for orders that are needed, and 1 patient just described crushing chest pain. Not only does Sue have to, quote, give sponge baths, give out pills, and empty bedpans, she needs to monitor, intervene, and ensure the safety of each and every one of these sick patients. Somewhere in these 12 hours, she has to eat, drink, and use the washroom herself, needs that are often low on her priority list. She has to read and rewrite every order a doctor has written on these charts, review it for appropriateness and accuracy, call the doctor back several times for clarification, or to inform them that the patient is allergic to the drug they prescribed, and then notify pharmacy to have the medication delivered. Sue also has to document every single thing she did, everything that went in and came out of all of her patients, the medications she gave, how they worked, and every conversation she had about anything in regards to the patient care. We are taught in nursing school that in a court of law, if it isn't charted, it wasn't done. And if you face a lawsuit 10 years from now, your charting is the only thing that will save your license. Sue survives her shift, and luckily, so does all her patients. The day wasn't good, but it easily could have been a lot worse. She drags her exhausted self home with plenty on her mind. She worries about the patient showing signs of sepsis and whether or not the doctors will heed her warning. She worries about the novice nurses with similar assignments and how they got through their day. She feels guilty she was unable to provide more support to them today. She looks at the bruise that's developing on her arm after being struck by that violent patient. And she's thinking about how she wished she had time to comfort the vomiting and crying patient. Dumping the bucket of vomit, giving a medication, and running off isn't the kind of nursing she signed up for. But over the last 3 years, she's learned that nursing at Capitol Health is nothing like they teach you in nursing school. Every shift is a battle just to keep your head above water. If she wants to give her patients what they need and deserve, she knows she will have to find a job elsewhere. So she starts updating her resume. So I ask you now to describe what exactly a nurse does on a typical hospital ward. I expect your answer might be quite different. Does this sound like good working conditions? If you were a patient, would you rather Sue was replaced with a nurse with less training, so that the institution can save some money and surgeries wouldn't be canceled? Would you rather be one of 4 of her patients or one of 7? Would you get on a plane that has eliminated the co-pilot? Nurses go to work every day because we care. No money in the world can unsee the horrors that we've seen. No money in the world can erase the memories of the heartaches that we've witnessed. And no amount of money in the world can bring back a life that was lost unnecessarily. We, in asking for nurse-patient ratios, are asking for your safety. Nurses are the hands that welcome you into the world. We often give you your first bath, and we often will give you your last bath. And we will hold your hand and comfort you on the way out. And most likely, we are the hands that saved your butt several times in between. You might not be a patient in these hospitals right now, but tomorrow it could be you, or your mother, or your son, daughter, sister. In NSGEU Local 97 nurses are asking you, the public, to care about your own safety as much as we care about it, because as a group, we are scared for you.